I'm gonna teach you about the basal cell carcinoma. It is the locally aggressive tumor, second most common tumor, and it arises to the mutations in the sonic hedgehog signaling pathway. I will talk about it later. Its pathology is that mutations in the PTCH are basically these mutations affects it. I will discuss with you people afterwards after arises by the mutations in the PTCH pathway. I will further explain you. But moving on its morphology, the grossly it appears as a pearly plaques. We see pearly plaques, we see prominent dilated subepidermal blood vessels. That is also called telangiectasia. So the telangiectasia, we see pearly plaques grossly, and we see prominent dilated subepidermal blood vessels. That is telangiectasia. Okay, and the superficial lesions basically resembles melanocytic nevi. It is very difficult to differentiate it from the melanocytic nevi, and then advanced lesions may ulcerate, and the designs of the archic design of the ulcers, due to the archic design of the ulcers, it is called the rodent ulcers. Okay. In invasive cases, there will be ulceration of the cancer. Grossly, it appears as pearly plaques. There will be prominent dilated subepidermal blood vessels. We see superficial lesions that resemble nanocytic nevi, and in advanced lesions, the tumor will ulcerate and look like rodent ulcer, like it resembles a rodent. So it is called rodent ulcer due to its archaic design. Okay, and it is invasive. In histology, if we see histology, in histology we see multifocal growth pattern, that is superficial spreading. Means, what does it means? That if multifocal growth pattern, superficial spreading means that there will be no invasion. Okay, multifocal growth pattern means that the tumor spreads like this. Okay, like this it spreads. Okay, several centimeters it spreads superficially. Okay, okay, and if we see in case of this is superficial spreading, and if it's invasive, it may spread deep down into the dermis. It is also have invasive pattern. Okay, invasive pattern of spread, invasive pattern, or the other pattern of spread also. In microscopic ulceration, when we can see the superficial spreading pattern it has, or it has ulcerative pattern. Okay, ulcerative pattern, I will write it, ulcerative, not invasive. Okay, and in microscopy, if we see nest of basaloid cells, we see hyperchromatic nuclei. Okay, basaloid cells are like this, nest of basaloid cells we see. Okay, having micro hyperchromatic nuclei if we see. Okay, and we see peripheral parasitic. Parasitic basically is what? Parasitic basically is the wall like this. These are parasites. Okay, so we see peripheral parasitic. I will show you the diagram of the basal cell carcinoma for your better understanding. The walls basically, here grossly the basal cell carcinoma, you can see the dilated blood vessels as in red there. This is the basal cell carcinoma. It means look like pearly plaque, or it has dilated blood vessels, that is telangiectasia. Okay, you can see here in below it is melanoma, and uh, opposite to it you can see the squamous cell carcinoma. Let me show you another figure that is ulcerative pattern of the basal cell carcinoma, and it is the rodent ulcer. Let me show you its microscopy. In microscopy, you can see the many cells as in purple. You can see the many cells. They are hyperchromatic cells, and I will show you the parasites. These are the parasite. This is parasiting. This is what we call parasiting. Okay, the tumor is lined by the parasites. I mean the parasitic pattern it shows, and we are having many hyperchromatic nuclei we see, and we see the parasitic pattern. This is the parasitic pattern. Okay. The basal cell carcinoma is that when the sonic hedgehog binds, there will be fusion of the PTCH and SMO. Okay, when the sonic hedgehog binds, the SMO get dissociated from the PTCH, and the ligand dependent signal transduction starts. There will be transcription factor GL1, there will be activation of gene, and the normal development, and unregulated there will be normal development. Okay, in case of basal cell carcinoma, there is a mutation in the PTCH, and when there will be mutation in the PTCH, the SMO remains activated irrespective of the SSH, irrespective of the sonic hedgehog. In normal conditions, sonic hedgehog is required for the activation of SMO and for the signal transduction. In basal cell carcinoma, there will be mutations in the PTCH, and the SMO remains activated irrespective of the fact that there will be binding or not of the SHH. There will be signal transduction. Independent ligand independent signal transduction means ligand which is SHH, sonic hedgehog, is not there, and there will be continued signal transduction. There will be continuous transcription factor activation and continued gene expression. Due to this, there will be unregulated cell division irrespective of the ligand, that is a sonic hedgehog. This is all about the pathogenesis of the basal cell carcinoma.